So we'll just open the meeting, Jerry. Is Rini joining us, or is she just going to do it on? No, okay.
She'll just watch.
Okay, that's fine. Just want to make sure. Do we want to go over the minutes, approve the minutes real quickly? I know you forwarded them to us already, Jerry.
I forwarded them, and if you can take one set and sign
Shelley?
Yes.
one set.
I call the meeting of the Board of Health to order on May 5th at 4:25, town of Southampton.
Okay, thank you, Charlie.
I'm just, because it's recorded, they're gonna need some kind
No,
of,
that's fine. This is, new to me, so I'm not
it's
used to.
cool, and putting a mask on
So
and
I
trying to talk
appreciate it.
is like,
It's all new. The glasses are fogging. It's all new. So thank you. I appreciate that.
Speak up.
Okay, did you guys get a chance to look at the minutes that
I
Jerry
did.
forwarded?
Yeah.
Happy to do? Okay.
She has a clean copy, so she's
Okay,
gonna...
okay, perfect.
I move to approve the minutes as written for, I don't have the dates in the handy here.
We have March 10th, 2020. We have March 23rd, 2020. We have March 26th, 2020, an emergency meeting, COVID-19. And we have April 24th, emergency meeting, COVID-19. I second that.
Aye.
All in favor?
Aye,
Aye.
Thank you.
it's unanimous.
Becky, I'm going to give this back to you right here.
Is this yours, Sherry?
Oh, yeah. Yeah, came up with that.
I'll meet you halfway.
Okay. All right. The next on our agenda is housing complaints updates.
We have not had any...
Jerry? Podium, please.
We have not had any housing complaints since COVID hit. We'll get into the Perk tests in Title V. Food inspections were all done just before
Okay, perfect.
COVID, so we're in good shape there. And then Nicole can tell you about Perk tests in Title V. Do you want to do that, or do you want me to? Okay.
As far as perk testing in Title V, I've done about a dozen in the last week or so, so we're fairly caught up. This next week, there's about 6 or 8 more scheduled, so we're getting everybody caught up from the 3-week hiatus.
Have you had any problems with anybody not following the rules, or were they all pretty good with
Nope,
that?
I handed out the page about the wearing the mask, and everybody's had them, and on the perk tests, those take a little longer, but everybody's really distant, waiting for them to finish, so there's been no problems.
That's great.
Yeah.
Has there been a lot of repair work being done this year?
Not yet. A couple of final inspections I've been doing were from repair perks from last fall. I think I've done 3 or 4 finals this week that were just, systems that had failed, that they were held over from October or November, so.
Be aware that the wastewater pumpers are having problems disposing the pumping. they're being channeled now mostly to Bondi's Island because the other facilities are not handling the amount of flow.
I'm sure.
So,
Yeah, I know, speaking to one of the pumpers this week, he said he's been very busy, so.
yeah, it's really gotten, it's funny how this is changing certain businesses around.
Yep. Okay. Any other questions?
That's it for right now. Thank you, Nicole. The next is the COVID-19 discussion and updates, budget planning, and public health trust fund accounts, the 4,000.
You want me to get into that?
Sure.
You want to go to the podium or you want to?
Go to the podium. That way everybody can hear you.
Now I can see you.
I know.
Before it was like, there's a voice over there.
She's over there, the other end of the table.
Well, just to refresh, as you're aware, that the Board of Health received about $9,000 in grant money, and the state's now asking for a budget as to how this money is going to be spent down. They need this report done by Thursday of this week.
Correct.
And so Jerry happened to realize that I've been doing budgets for other communities. So in her zeal to make sure I keep busy, she asked me to put together something for Southampton. Basically, what you're seeing here is the protocol to take and set up for a vaccine clinic. The long-term hope is a vaccine gets developed, and we will be purchasing equipment so that we're able to take and run a clinic in town. That's what this whole $9,000 budget is about. But it also allows us to have some equipment available to assist the town clerk with the election and other things that might happen in town. So that's why we put this together. If you see something there that you disagree with or you'd like modified, just let me and Jerry know.
Okay.
But I think at this point, seeing Jerry's the director, I'm handing this back to her.
They're also today on the DPH's conference call. Kelly Driscoll was letting everyone know that under the CARES Act, municipalities will be getting more funding, and right now they're trying to decide on, how they're going to get the funding out to municipalities. It may be depending on your population and certain other factors. We could also do testing with this money. And okay.
Okay, just only because I'm involved in that also. The CARES Act is basically to fund the holistic approach of how COVID is hitting these communities.
Right.
So that means that this funding is going to be available through the Town Administrator Board of Selectmen's office,
Correct.
not through the Board of Health, and it's geared towards all town activities relative to COVID. Yes, the Board of Health could ask for money to be drawn through that, but it's also going to take and do, I don't know, we'll say overtime for the police department or some other activity that's being hit by the town.
It has to be supplemental to the budget. You can't be paying for instance, if you had a public health nurse, you can't all of a sudden just use this money to pay for
For the nurse.
the salary. No, it would have to be to pay for additional hours and overtime for police, that sort of thing. So as soon as they decide how they're going to disperse the money, that should be coming, and it'll be coming through, trying to think, she said how it was going to come through.
It's almost
Through
like,
local aid. It'll
Yeah, it's
come
like
through
state
local
aid.
aid. It's not going to come through as grant money or,
Okay.
right, and it's going to go to the town administrators, the mayor's offices and that,
right.
not to the Board of Health. So,
That's all right.
no, I'm just making, we have an audience, and I want to make sure everybody
That they
understands.
understand where the money is going to be coming
Right.
from.
Right,
Yeah.
you know?
That's because the money is for all of the departments
Right.
and anything
Right.
that involves COVID-19.
So this is what we're submitting to the state.
This is to legitimize the amount of money that we've already received.
Yeah,
This is our budget. Once we submit this $9,000 budget,
Yep.
it's my understanding that this is going to have a renewable contract, and we may be able to hold this money up to a year.
okay.
But given the reality that some of the things on this budget, we can't purchase right now. They're not
Yeah.
available.
I was just going to ask that. A lot of these things aren't even available. Okay,
But we have to legitimize the spending of this money to the Commonwealth based on the contract that was signed between the town and Pioneer Valley and the Commonwealth.
okay. So I motion to accept this
Proposed budget.
proposal for the $9,000 that the state has.
I second. I think it looks good.
I think it looks really good.
Yeah.
Great job, Charlie. Great job,
I gotta
Terry.
earn my
I
keep
second.
doing something.
All in favor?
Aye.
Aye.
Okay, it's unanimous. You want to get into the monitoring program for COVID?
Sure.
Jerry, you want to do this one, or you want me to?
You can do this one if you want to.
I mean, the two of us are going back and forth like,
Start it, and I'll jump in.
yeah, you know? It's like, well, we put together a partnership with the town of South Hadley on this.
There you go, good.
We put a partnership together with the town of South Hadley on monitoring the MAVEN program, and I believe that's been excellent. We get up to the minute what's going on, we can ask questions, there's good follow-up. Presently, according to the state, we have like 25 positives, but I want to stress this, that number doesn't take away from the people that have recovered. It just keeps going up. And in my mind, that's a misleading number. We have no police and fire, first responder, dispatch health issues right now relative to this. So the town's in pretty good shape with this monitoring program going on. But I believe we need to sit down and actually put an MOU together
I agree.
between South Hadley and Southampton for the long term of this. I haven't had an opportunity to do it, but I think we need to. I don't know how Ed feels about it, but
Well, I know there was a concern about the Pioneer Valley down the road. We talked about joining with the Pioneer Valley, didn't we?
Well, actually, there's I'm sorry.
It's okay.
I'll let you discuss the consortium that,
I think South Hadley's working out phenomenal.
South Hadley's covering Hatfield, Hadley, South Hadley, and Southampton. I think what's happening with the consortium that was developing in Pioneer Valley is they got too large too fast,
Okay.
okay? The other thing that's going on is we need to circle back as a board and get our health director to get back on the MAVEN to be doing the day-to-day
I
MAVEN
think
monitoring.
Nicole's doing the day-to-day, aren't you, Nicole? So Nicole is checking in day-to-day. I did follow through with that with her, and she said she does check in day-to-day.
Are you doing the follow-ups?
I get all the emails for all the stuff that's
Nicole?
happening.
Thank you.
Yes, I get all the emails for anything that South Hadley's doing. I get a notification, and then anything that's just regular day-to-day, I get and do the follow-up. So like any of the Lyme disease and the flu, that kind of stuff.
The concern, my concern, is that right now we have an agreement verbally with South Hadley. Nicole, please stay at the podium, because they'll be bouncing back and forth. But what's going to happen long-term here is we need to have our staff doing this. So we need to get Jerry back onto the MAVEN as the health director, as well as you. I understand you're out straight right now, and I appreciate that, given what's going on. But somewhere down the line, this is going to come back to a normal situation. So we need to take and have an MOU with South Hadley, this is me talking, for the overflow influxes that develop, but we also have to have our internal employees do the day-to-day as time goes forward.
Okay, that would just be,
Yeah.
Yeah.
I think that was why we had talked about the public health nurse too, because there was some stuff in there that was like above me as far
so
as
that's when
my.
we talked about bringing a public nurse
Yeah,
in. But
'cause
we
there's-
have that, we'll have that through South Hadley, we'll have the nurse.
We do.
Yeah,
Put a public health nurse in the budget.
Yes.
We should have somebody
yeah, no, I don't disagree
that,
with you.
you know, even if it's just part-time. Because there are things that are beyond. If you're not a clinician, then it's, you know,
I agree.
difficult. But I think we do need to do the MOU with South Hadley, and it's working out beautifully. There have been no glitches, no issues. The contact tracing that's being done by the state, I don't know if they seem to be having little issues with Maven because they've used students, I think, to do some of the contact tracing, the calling, but then they can't put the information into Maven. So people are getting calls from two different people, and I think it's confusing for the person that's sick or who has been the contact. But we don't have that issue because everything stays
Right.
at one level. So,
So if we could do something going forward with South Hadley, and you said she does those other surrounding towns, that would be great.
yeah, we can put an MOU
So
together.
you want the two of us to start kicking that
I think
around?
that's a great idea. I'm good with
We'll
that.
do
Are you
a
good with that?
draft
Good with that?
Yep,
and send it out to you.
I think that's an excellent idea.
Okay.
You're safe, Nicole.
Okay. Anything else with the COVID-19, Charlie, that you've been working on? Or Jerry?
Well, I'm trying to think. It's just busy. It's just incredibly busy, and now everything is beginning to sort of open up, and there are discussions. There was a discussion today with DPH on the conference call, and they made it very clear that the task force, the governor's task force, the 17 folks, they're not going to give any information out until the 18th or even beyond that, they said. So we don't know how things are going to work out with really summer camps for kids.
I know that's a lot of people's concerns.
I mean, we have issues with golf courses now because people are going to Connecticut to play, and then they're coming back. So that all needs to be ironed out. And they're just, you know, the everyday calls. Can I please get a copy of my septic system so I can get it pumped? And I'm trying to see what else there is. I think most people are very good about wearing face coverings in the stores.
Well, Charlie just sent out an email regarding the letter that
That there'll be a fine.
there'll be a fine.
That's,
The police.
and that was put up today on the website.
I think that's great.
The governor's order and the guidance document.
Can't figure out what I'm thinking with a mask on.
No, I can't.
You can't
I don't like
read
you
my-
with the mask on.
Ideally, we'd like
be sticking your
people
tongue out at me and I wouldn't
to
even know.
understand. Somebody's going to go to the store, they will have forgotten their mask, and I am sure that the store will be glad to give them a disposable mask.
Yeah, the MOU, police and health.
I just certainly hoped that we wouldn't get anybody that was stubborn and just said, well, I'm not going to do it. And I think we'll just have
More of a
to,
matter of understanding that it's safe for not us. It's an understanding of safety, not only for us, but them.
Right.
It's safety for everybody that anybody should come in contact with.
and the reason our numbers are low in town is because everybody's been doing what they should be doing.
Yeah, I know.
Yeah.
So now that the weather's getting warm, it's getting nice out, Still just follow the rules.
All the
And
guidelines.
we'll be okay.
My question was, do we need to vote on this MOU?
For the police and
Yeah.
Board of Health? I think we need to. The problem,
thought so.
what we have here is a draft.
Yeah,
So I would make a motion that we approve the intent of this MOU for signature. And because what's happening right now is the Police Chiefs Association and the attorneys for the state are meeting tomorrow
okay.
to discuss this even further. So something might change that we're just not aware
Yeah,
of.
we can vote to accept the draft.
That's what I would do.
Yeah, I agree
Just
with
so
that.
that there's something there.
I don't think there'll be too much that's going to be substantially different. They just want to make sure,
Yeah,
that everybody is legally on the same page.
so I second that. I second to accept the draft, the way it's written.
We certainly are writing a lot of MOUs. A little curiosity statement. It was back by March 10th, I believe, that the first statement came out of the governor's office and relative to policy. We're up to policy number 27 right now, if I remember
I
right.
thought it was 31, no?
All right, 31. Well, I plotted it out just for ha-has yesterday. Every 1.8 days, there's a new policy coming from the governor's office. So trying to keep up to all the changes that's going on.
And that includes
Wow.
everything on that essential services list, too.
Wow.
Because there are changes constantly. And there'll be more changes coming, little by little. I think the Department of
Oh, yeah,
Labor is,
they've just chimed in.
they just chimed in too. So there are going to be some changes, and I just found out about this at 3:30 this afternoon, so I haven't even had a chance to look and see what those changes are. It goes all the way till 10 o'clock at night. We're getting
I know,
emails.
I know, I know.
It's crazy. So you made the motion to accept the MOU, and did Becky second?
Shelley
She
second.
seconded it.
Who made the motion?
Charlie made the
Charlie
motion.
made the motion. Okay, great. And you're all in favor? Okay. All right.
What about planning for a potential second wave?
Well,
Or do you want
part of the budget we just put together is that
It's gonna help
planning.
plan with this, yes.
We all seem to be pretty much in agreement. There's going to be a second wave.
Matter of when again.
Yeah, it's a matter of when.
Yep.
I mean, everybody could take a lottery number and try to figure out what month, but it certainly appears it's going to. So I think we just have to be cognizant of that and just try to plan as things develop. But the budget was basically set towards the second wave, and it was set towards trying to assume there's going to be a vaccine coming. Now, there's another side to this second wave, and that's my other alter ego as the emergency manager, and trying to keep our first responders stocked with supplies and everything else. We've managed that very well. We have supplies on hand for at least a week to 2 weeks out, depending on what it is. We have the N95 masks, we have the gloves, so on and so forth. The only short thing is the gowns, but nobody's getting the gowns right now.
Yeah, no one is. I
But-
actually just had a friend who does the shopping for Bay State, and her team got a shipment for $30,000 worth of gowns.
Yeah.
She got the box, it was opened, and there was vases, broken vases in there, and all the gowns were gone.
Yeah. My wife put together, I guess, about 10 cloth gowns for the fire department that are washable. So if desperation happens, they at least have something.
Nice.
But she's not into masks.
No.
No.
A lot of people are doing masks. Did we look into we talked about the quilt. You were going to check
The
in
quilt
with the
shop.
The quilt shop with the masks.
I didn't get to see
Okay.
her on Thursday, but she was going to check with the COA and see if they needed any more masks. And I spoke with Joan the other day. She said she had 6 left. My understanding is the Congregational Church is going to be giving out masks too. So
When are they going to start that?
I think this weekend, Saturday, I think it's all in Robert Floyd's letter. But I'll have to catch up with, I think her name is Rachel Senecal that owns the quilt shop on Thursday. She and several other women had already made 1,000 masks, so
Great.
she's got a system.
That's awesome, thank you.
Yes.
Do we have a plan? I think we need to work on a plan preparing the town offices whenever, senior centers, what are we?
Us, have all been sort of watching the governor's office to try to glean what's being expected of us. We had a webinar with the federal government last Friday, and I sent
the
everybody the PDF files on that, but I didn't get much out of it personally. I don't know how anyone else felt about
I
that.
unfortunately wasn't able to attend. I had
It was
family things going on.
I understand. But, so at this point in time, I think this is a holding pattern for
I
us
thought.
until we see a little bit more coming out of the governor's office.
Well, I think at this point, things are still running fairly smoothly.
Yeah.
Here, people, if they want to drop things off, they can put it in the drop box out here in the treasure collectors. They pick the mail up out there, and then they just put it in our mail slots, and everybody gets back to whoever
Yeah,
needs.
no, I think it's been working really nicely.
We're still
think there's
bringing
a
in
need.
revenue. Pardon?
Not a need to open up right
I
now.
don't think there's a need. I
There
would prefer
is
not
no
to.
need.
No,
And I
not
think
yet.
that the people that work in the building do have some health issues, and they would prefer, until we're really sure where we are, not to open it to the public.
Yeah, I agree.
I mean, this room will be open for voting, I believe, on the 19th.
Well, when we get to that, we can,
Okay, I don't want to jump in.
no, whichever. No. You want to jump into the election stuff?
Yeah.
Might as well.
Okay. We being, all of us have had meetings with the town clerk relative to this. We've developed a strategy. It's the state election for Senate that really is the one that's pushing this right now. And the thought was to have the entrance set up with a pop-up tent over there at the senior center. People come over there, we'll offer to take their temperature and make sure that they have a mask, and then we'll set them up along the sidewalk with the handrails every 6 feet.
Okay.
Then they'll come around the double doors here, and we're going to take the stairway and basically say you can't use that. And then come around this way, they'll check them in right there. They'll only allow 3 people at a time. They'll set up the booths here. We have masks, face shields, and gloves for the registrars to do this. We have some sanitizing equipment and stuff. People will vote. They'll go out this door, go around the back of the building to go back to their vehicle. So there's none of this crossing paths with people.
Yep.
Once they vote, somebody will come over and sanitize the booths,
And 3 more people will come in.
and 3 more people will come in.
Do we have an option for people who can't stand that long?
That is a dilemma.
Good question.
And I think the best way to handle that is if somebody comes over to the nurse that's doing the temperature and says, I cannot stand because of whatever reason, we'll try to fast track them somehow.
Right.
I saw that at the, what do you call it, the Chinese restaurant the other night.
Westlake.
Yeah, because there was a guy that went in there with braces on and everything else, and they put him to the far end of the line.
Oh,
And so being who I am, I walked in, bought his meal, went over, handed it to him so he could go home. But
you're so nice, Charlie.
I know, I have my issues.
I wonder, I don't know how easy it would be to, wonder if we had like a time slot for, the seniors and stuff that could come in.
I think there should be a time slot for the
let the
seniors.
seniors come in.
Yeah.
That's not our decision.
That's not our decision.
We can suggest that to the town clerk.
Because a lot of, I mean, there will be still people that will have a hard time standing that won't be seniors, but,
Or somebody who just can't, I mean, that line is going to deter a lot of people. I
Because-
hate to say
I
it,
know.
but the
And it's
weight
gonna-
and
the
the
weight.
patience.
Well, the town clerk runs the election. The best we can do at this point is suggest to her that if we have people that need assistance, if there's a way that she'd allow somebody to cut the line. But we'll have to suggest it to her and see what she thinks.
Yeah. It's going to be challenging.
yeah, she is.
Yeah,
She's always
absolutely.
open to suggestions. Okay.
In terms of schools, Charlie,
I think we still need to wait on the governor for all this, so there's nothing really to discuss. Everything we're going to discuss relative to that would be hypothetical, and we
Yeah, and
could be...
we'll get some notice. We'll have like, we can always have another meeting within a week or something. 'cause
Yeah.
he'll
I
give us
think the
another date.
schools are doing a fantastic job. I mean, they were quick to jump in and modify their teaching habits and,
They're working really hard
yeah,
right now.
dropping
teachers.
papers off to students, offering,
Yep.
you
they
know,
really are.
computers and electronic devices to those who don't have them. So they've really done an amazing job.
That's great.
We'll just have to wait on the school. There's nothing for us to
There's
say.
It's just like everything. There's not much we can really do right now because we have no idea when things are going to open back up. Okay, any other business?
Just an observation,
Yes.
we're talking about next year's budget. We may not see next year's budget until September, October.
I know.
So just be aware, we're going to probably be operating, and Ed, you can correct me if I'm wrong, but we're probably going to be operating on a 1/12 budget in July and August, probably into
Oh, yeah.
September.
Not good.
Again, there's not much we could do about it.
There's nothing to do.
Nothing we can do.
No.
It's too bad. Anything else?
anything else?
How's the animal?
Fine, everyone's home with their animals, so they're not running around.
So you're getting a break from that. That's great. That's awesome. I'm glad to hear. I'm glad to hear. And I'm sure the realtors and Title V inspectors are happy that they can be back out there again. So I'm glad we were able to do that. Good.
Make a
Anything else
motion.
at all, Jerry?
I don't have anything else, and
Okay. Are
Motion
you all set?
adjourned?
Motion adjourned.
Motion adjourned.
Great. Thank you, everyone.